So we are doing what is means of ARDS. ARDS is a what is the meaning of ARDS? ARDS it is a medical emergency. What is the first of all what is the meaning of ARDS? ARDS is a characterized by means it is a type of the acute diffuse lung injury. Acute and diffuse lung injury associated with recognized risk factor. Characterized by inflammation and increased vascular permeability. There is a definition of ARDS. ARDS means it is a type of the acute lung injury done by the recognized risk factor, characterized by inflammation and increased vascular permeability. ARDS was first described by the Petty in 1967. ARDS was described as a syndrome of the acute respiratory failure in adult characterized by non-cardiogenic pulmonary edema. Some of the doctors are also tell that ARDS is equal to non-cardiogenic pulmonary edema. Non-cardiogenic pulmonary edema manifested by the severe hypoxemia, that is characterized by severe hypoxemia caused by right to left shunting through the collapsed or fluid filled alveoli. Okay. ARDS means non-cardiogenic pulmonary edema, which is associated with the severe hypoxemia and right to left shunting through the collapsed or fluid filled alveoli. Whatever the origin of ARDS, diffuse alveolar damage is considered the histopathological equivalent and morphological hallmarks of the ARDS. Presence of the hyaline membrane associated with the interstitial edema, cell necrosis and proliferation, and then fibrosis at the later stage. So ARDS. So till now what we know that ARDS is a type of the acute diffuse lung injury associated with a recognized risk factor that is characterized by inflammation and increased vascular permeability. And in a simple term, ARDS means non-cardiogenic pulmonary edema, which is associated with a severe hypoxemia and right to left shunting of the blood via collapsed or fluid filled alveoli. Any doubt? Chat. So histopathologically, whenever we see histopathology of ARDS patient, there is a hyaline membranes associated with the interstitial edema, cell necrosis and proliferation, then fibrosis at a later stage. Okay, there is a hyaline. What is the histopathological examination showing? Histopath is showing hyaline membrane associated with interstitial edema. Hyaline membrane associated with interstitial edema plus cell necrosis. Okay, there is only two things: hyaline membrane associated with interstitial edema and cell necrosis. There are only three things. It is a normal introductory part of the ARDS is done. Now we are going toward what is the epidemiology of the ARDS. It is a multi-center prospective cohort study suggestive of the mild ARDS, moderate ARDS, severe ARDS. There is always higher prevalence of the moderate ARDS. Before COVID-19 pandemic, the diagnosis of ARDS was not made in a high proportion of a patient with condition. Now, what is the definition? Berlin definition. Berlin give a definition of the Berlin definition for ARDS. Berlin definition of ARDS. Berlin suggestive of the four things. There are the Berlin have onset. First of all is onset. Second thing is in the chest imaging. Third is a pulmonary edema. And fourth is a classification. So onset, as per the Berlin, onset is within the 7 day of the insult. That is within 7 day of known risk factor. Then chest imaging, it is a bilateral opacities consistent with pulmonary edema. On CXRPA or means chest radiograph or CT scan. Bilateral opacity consists with the pulmonary edema on chest radiograph or CT scan. Then pulmonary edema. Pulmonary edema is a non-hydrostatic, means non-cardiogenic. Non-hydrostatic edema, not fully explained by heart failure or fluid overload. Okay, less than 7 day of non risk factor. Onset is less than 7 day of the non risk factor. Then chest imaging showing the bilateral pulmonary infiltrates, bilateral pulmonary opacities, which is with pulmonary edema on chest X-ray or CT scan. And last, pulmonary edema is which is a non-hydrostatic edema, which is not fully explained by heart failure or fluid overload. Echocardiography or other objective measure may be required. Okay, 2D echo may be required. Classification is a mild, moderate, and severe. In classification of the ARDS as per Berlin, we have to see PaO to FiO2 ratio. PaO to FiO2 ratio. PaO2 we get it from the ABGA, and FiO2 on room air is at 21%. If a patient is on ventilator, suppose there is a FiO2 we can see in the ventilator. We can see on the ventilator. So PaO to FiO2 ratio, if it is less than 200, it is a mild. No, it is a 200 to 300, that is a mild. Moderate is a 100 to 200, that is a moderate, and less than 100, it is less than or equal to 100, that is a severe. 200 to 300 is a mild, moderate is a 100 to 200, severe is less than 100. It is a Berlin's definition of the ARDS. Now, what is the criticism of the Berlin's definition? ARDS Berlin definition. We have seen that ARDS, as per the Berlin ARDS definition, timing is within 1 week of the non-clinical insult or new or worsening respiratory symptom. Second thing we have seen is the chest imaging. Chest imaging, the Berlin's bilateral opacity not fully explained by the effusion, lobar or lung collapse or nodule. Third thing is the pulmonary edema or respiratory failure is not fully explained by the cardiac failure or fluid overload. Need objective assessment, that is echocardiography, to exclude the hydrostatic edema if no risk factor is present. Then we have seen the classification means oxygenation, PaO to FiO2 ratio. In this we already seen that mild, moderate and severe. If there is a mild edema, that is a PaO to FiO2 ratio is a 200 to 300, moderate 100 to 200, and severe is less than 100. Level of the PEEP is not well explained. What are the critics? What is the that? What are the criticism of Berlin's definition? First, level of the oxygenation is not maintained. Level of PEEP is not well explained. When we know that whenever patient is intubated in ARDS case, we have to increase the PEEP for better fluid extraction. So level of PEEP is not mentioned in the definition of the Berlin's. Second thing, lack of the standardization. Means these all are the criteria is a subjective criteria, not objective criteria. There is a lack of the standardization of the ventilator setting. Third thing is no proper timeline of doing ABGA. There is no proper timeline of doing ABGA. Means three things is the level of the PEEP is not mentioned clear cut in the Berlin's definition. The second thing is the lack of the standardization of the ventilator setting. Third is the no proper timeline of the doing ABGA. This we taught current now we have seen that what is the definition of ARDS, what is the mean by ARDS, in simple term what is the ARDS, what is the histopathological, and then we see the Berlin definition. After that we are going towards the what are the risk factor, disease progression and clinical feature. First of all, clinical risk factor. What are the clinical risk factor of the ARDS? Clinical risk factors. Clinical risk factor, there is a pulmonary and extrapulmonary. There are the two kind of the risk factor, pulmonary and extrapulmonary. Pulmonary and extrapulmonary. Pulmonary means what are the risk factors for the pulmonary ARDS? First of all is the pneumonia. Then is a pulmonary contusion. Third is the inhalational injury. Fourth is the aspiration pneumonia. Aspiration pneumonia. Fifth is a fat embolism. Sixth is a near drowning. Last is a reperfusion injury. So pneumonia, pulmonary contusion, inhalational injury, aspiration pneumonia, fat embolism, near drowning and reperfusion injury. Then what are the extrapulmonary risk factor for the ARDS? Extrapulmonary sepsis, trauma, burns, acute pancreatitis. We have seen a lot of the patients that are extrapulmonary sepsis, trauma, burns, acute pancreatitis, massive transfusion and drug overdose and cardiopulmonary bypass. Sepsis, trauma, burns, acute pancreatitis, massive transfusion, drug overdose and cardiopulmonary bypass. Now, extrapulmonary risk factor can cause inflammation, leads to the severe inflammatory reconstitution. How the extrapulmonary can cause the ARDS? Extrapulmonary risk factor can cause inflammation, which is causes increased risk of the SIRS. Then it will lead to the second attack on the lung, and which is lead to the ARDS. Disease progression exudative stage is a 0 to 6 day accumulation of the excessive fluid in the lungs due to the exudation and hypoxemia. The disease progression, first of all, is we seen that the clinical risk factor. After that, we are seeing the disease progression. How will disease progress? Disease progression, first there are the actually in disease progression there are the three stages. Stage 1, 2, 3. Stage 1 is the exudative stage, stage 2 is the proliferative stage, and stage 3 is the fibrotic stage. Exudative stage is the accumulation of the excessive fluid in the lungs due to exudation. It is a lasts for 0 to 6 days. Okay, and it is also associated with the hypoxemia and excessive fluid accumulation in the lungs due to exudation and hypoxemia. Then what is the proliferative stage? Proliferative stage is 7 to 10 days. It is associated with the proliferation of the type 2 alveolar cell, fibroblast and myofibroblast. Connective tissue and other structural element proliferate. Stiff shock lung,